Hello friends, in this video we'll talk about the axillary vessels and the nerve, okay, in the axillary nerve applied aspect. Right. First we'll discuss about axillary artery. So here we are finding the course and branches. So it arises from the subclavian artery. Subclavian artery is coming out of the first rib, okay. So it is dividing into three divisions, 1, 2, 3, okay. So first division gives superior thoracic artery. Second division gives thoracoacromial artery that pierces the pectoralis minor muscle, and also we are finding the long thoracic artery. Then this is continuing as the third part. This is the second. This is the both subclavian and axillary. This is the axillary part. Now we are coming to the axillary part. In the axillary part, we are finding the subscapular artery, the circumflex scapular, and humeral. This is circumflex humeral. This is circumflex scapular. Then this is the teres major. So the third part pierces the teres major and continues as the brachial artery. Okay. Yes. Let us see with the relations of the axillary artery. Three parts. So now we are finding the three parts. Okay. So here first and second will be very similar. Pectoralis major is there in both. Okay. We have the cords. Cords are common. Lateral, posterior and medial cords. Okay. Remember as MPL, Mobile Premier League. Okay. Then medial and lateral pectoral nerve. That is the nerve supply to it. Okay. And here we'll have the long thoracic nerve with the serratus anterior. But here we are finding subscapularis and pectoralis minor extra. Okay. Third part is totally different from all of these. Here we have this musculocutaneous, axillary, radial, ulnar, medial cutaneous nerve of forearm and arm, the axillary vein, subscapularis and teres major. Okay. Right. Now let us see with the axillary vein. Okay. So what will be the tributaries of the axillary vein? Just like the artery only. Here we are finding the, it's just like the artery only. Okay. You will find the tributaries. Okay. And here at the same time lymph nodes also we can appreciate. This is apical. This is what do you call? This is subscapular. This is the pectoral. This is the central group of lymph nodes. Okay. Right. Let's see the applied aspect. Axillary nerve injury during IM, intramuscular injection. So here in the upper limb, where is the intramuscular injection given? Deltoid muscle. Okay. Please don't give it directly. Okay. So during surgery, what they do, or I should not say surgery, during the treatment, when there is an injury to the axillary nerve, the intramuscular injection is given 45 degrees in the deltoid muscle. Okay. So if you give it directly, what happens? The movements of the deltoid and rotator cuff will go paralyzed. Okay. Yeah, that is important. So references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.